Hello, Edson and surrounds. I'm Dr. David Wannenberg, and you probably recognize the faces that are sitting in front of you. This is just 5 of your 15 physicians that work in town and serve Edson as a town, as well as the surrounding Yellowhead County. And we have decided to make a video this evening and also a series of very short videos that will inform you and give you some information about some changes that your provincial government has proposed recently that we feel are going to affect the quality and provision of some of the services that you've come to know. Us as a physician group do various things for you. We see you here in the Edson Medical Centre where we're sitting at the moment. We also work in the emergency department. We keep that staffed 24/7, 365. We also provide your acute care as well as your long-term care services. So we're there from the beginning to the end, and most of us are involved in multiple aspects of that, whether it be anesthetic care, surgical care, obstetric care, delivering babies, your emergency care. We're kind of involved in all of that, and we're each just going to mention something briefly to you, and we'll introduce ourselves as we go.
So I'm Everett Zadrill, and I'm an anesthesia doctor in addition to being one of the family physicians in Edson. I'm especially concerned about many of the changes to emergency services in rural Alberta as proposed by your government and by the Ministry of Health. There's talk about recategorizing many of the rural hospitals. This would take the form of closing emergency rooms overnight, so there are no doctors, no nurses available for emergencies that happen overnight. This is about stopping doing obstetrics in rural hospitals and no longer having doctors on call for anesthesia services or for special training for doctors to be on call for cesarean sections in an emergency. We've had coverage since I've been in Edson for 24/7, 365 for almost 4 years for anesthesia services. This means that within 20 minutes, any of my colleagues can ask for help with an airway if someone's injured or critically ill and they're on their way to ICU or is on the way for them. It also means if there's an emergency for a cesarean section, if a baby or mom are in trouble, that we're available within 20 minutes. We also come in for providing epidural services to our community, other help with breathing services and other specialty stuff, sedations in emergency. If someone's hurt themselves, you need a second doctor to have the person asleep so you can set the brake, stuff like this. These changes potentially will devastate the ability for rural hospitals in Alberta, especially ours, to provide emergency care for our patients that equals what you can get in the city. We think we do a really good job of what we have right now, but we feel threatened that that may just go away because of these changes.
Yeah, I'd just like to maybe provide some practical examples to enunciate Everett's point here. Most of you know I deliver babies. In Edson, we've worked really hard in the last few years to make sure that our services in obstetrics are excellent, and we are meeting and probably exceeding the Alberta standard in regards to our outcomes with obstetrics, and we're very proud of that. We select our patients, our high-risk patients. We consult with the city, often Dr. Mayo, and they will go out, but we still sometimes have an unpredictable dangerous outcome. We will still have that unpredictable abruptio where that baby needs out in 30 minutes. If Minister Shandro, sitting in Calgary, does not value that anesthetists are paid to be on call in a rural community and surgeons are paid to be in a rural community, that may not be possible. That means that the standard of care for that pregnant mom and that baby is less as a rural Albertan than an urban Albertan, and that is not acceptable. This is two-tiered healthcare, but it's not private and it's not public. This is rural and urban, and that is unacceptable. The other thing, in rural Alberta, our kids are maybe a little bit wilder. They quad, they ride motorbikes, they hit the neighbor's barbed wire fence. That can be a really difficult surgical airway. All of us do emergency services, and we're pretty good at what we do, but sometimes we need a little bit of help from our friends. And our friends are our anesthetist and our surgeon on call. They can and have done surgical airways that have impressed our colleagues in the city here in Edson. Again, not very often, but it saves lives. And it's unacceptable that the health minister sitting in Calgary doesn't feel that that not very often thing is important, and that rural Albertans, that rural kids' life could be at risk where it wouldn't be in a more urban setting.
Absolutely.
So I'm Dr. Catherine Roder, and I'm the newest physician to come to Edson, and I was very excited to move to Edson because I was very happy with the group that Edson has. They provide very comprehensive care. They work really hard to get the clinic to become a medical home for patients so that we can do everything in the clinic possible for you in the least amount of visits, as much as we can. We can call you in to talk about results. We can talk over the phone about results with you. The changes that the minister has discussed and is putting through are going to threaten this, and I am terrified about that. It disincentivizes us to see our patients for longer visits because we physically can't do it. We have to go to shorter appointments to see more patients, but bringing people back more frequently and not being able to do things that we used to do for patients easily, like discuss your results over the phone when it wasn't a complicated issue. That means it's just going to struggle for patients to be able to come back to see us. We're going to have potentially longer wait times and just need more visits. This is also targeting seniors in a way where we're shifting the burden of cost from what we would pay, the government rate used to pay, to what now the seniors have to pay out of pocket as well.
Just to underline what everybody has said here, my name is Rudy Gauss. I'm also one of the physicians here, obviously. I also do obstetric care. I've been a part of the community for about 10 years. I am currently the acting community medical director. I would just like to explicitly say that I'm not speaking in that role at the moment, and I'm not speaking on behalf or for AHS. I'm speaking for myself and for my patients and for my colleagues. We're gravely concerned about what these proposed changes are going to boil down to for our patients individually. We think these will have immensely negative impacts for individual patients and for Edson as a community, and we fear that it threatens our ability to deliver comprehensive health care to our patients. As a group of physicians, we've worked extremely hard over the last decade to work towards providing you comprehensive medical care, to uphold your health outcomes as a priority, and making sure you hit your goals and be healthy. And we also hit our goals as being good primary care family physicians. We fear that these changes are making it hard for us to spend the time with you, as Catherine mentioned, in order to reach these goals. And we feel that our voices are not being heard, unfortunately, in this regard. We did meet with Honourable Martin Long in December, expressing to him our grave concerns for the 11 proposals that government now has unilaterally imposed on us. We feel that our voice was not heard during that meeting, and we feel it's time for you as Edsonites to speak up for yourselves and inform yourselves about what this actually means for you as an individual and how it will affect your relationship with your physician and your access to care.
Yeah, so just to wrap up this first video in our series that you're going to receive, I'd like to tell you that in the comments below we are going to have contact details for both the Minister of Health and also your local MLA, who is Mr. Martin Long. We've all made a concerted effort to phone, email, write letters to these parties that have influence over these changes that are going to affect your healthcare. We feel like the provincial government has and is repeatedly telling Albertan patients that these changes are not going to affect their healthcare or any services that they receive, and that is just simply untrue, and that's why we're sharing this information with you. So yeah, or next time you visit the Edson Medical Centre, for that matter, Mr. Martin Long's office is right across the road, so you can also just take a little stroll across there and chat to him. Otherwise, please write to them, call them, do whatever you can if you feel that this is something that may affect you or your family or your children or your loved ones in any way, because we're gravely concerned, and we want to continue providing the same level of care to you in a rural community in Alberta that we feel is, on the same level or superior to anything you can get in an urban center. And we're really proud of that, and we want nothing more than to continue with that level of care that we've been providing. So until we chat to you again, thank you for watching our video, and you'll hear from us soon.